You mentioned there that you can treat endometriosis through a laparoscopy. Is that the only form of treatment for endometriosis?
Yes, so in terms of endometriosis treatment, really you depends on the symptoms. So for pain symptoms, of course, best treatment of endometriosis is excision, which is removal of endometriosis, and using various pain protocols, manage the chronic pelvic pain, and of course you do hormonal treatment. So and you can do down regulation of ovaries. Essentially, but here we are mainly will be discussing the treatment of endometriosis in patients undergoing IVF. So in IVF, we first of all we need to know what impact endometriosis can make to the patients who is undergoing IVF. It really depends on location of endometriosis and severity of endometriosis. So if you have an endometriotic cyst, chocolate cyst, we usually recommend not to treat the endometriosis, not to remove the endometriosis by doing surgery. Why? Because when you remove the chocolate cyst, you remove sleeping eggs, you reduce the egg reserve, and which can actually make things worse. But in patients with very large chocolate cysts, especially if they have a lot of pelvic adhesions where the ovaries are not accessible, yes, we do recommend doing excision or surgery to remove or maybe drain the chocolate cyst to create some window where we can do IVF egg collection and create embryos. So that really very much depends on severity and type. Essentially in IVF, main impact endometriosis can make is if it's severe, it can push ovaries very high up. It may make it very difficult to access the ovaries. When you do ultrasound for monitoring or ultrasound for egg collection, ovary may be very high. So this is one problem endometriosis can cause in IVF. Second problem endometriosis can cause is reduced implantation. Usually stage 1 and stage 2 endometriosis don't affect implantation significantly and you don't need to do any treatment. Stage 3, stage 4 endometriosis, we do transfer embryos. If they have a repeated implantation failure, we recommend doing endometriosis surgery or down regulation of endometriosis using, for example, Prostab, Zoladex, or Lupron type medications. So really, as we said, 25 to 50% of patients undergoing IVF have endometriosis. It doesn't mean all these patients need to have a laparoscopy or surgery. So most patients with endometriosis undergoing IVF do not need surgery. And most patients, most probably 80, maybe even 90% of patients with endometriosis undergoing IVF do not need any laparoscopy, any surgery, even diagnostic procedure to establish endometriosis, and they get successful pregnancy with IVF. So, but in a small group of patients with where the ovaries are not accessible because of severe endometriosis, or they have a multiple large chocolate cyst occupying whole space on the ovary, and this why not allowing us to do proper ovarian stimulation. So, and also patients who have the repeated implantation failure because of stage 3, stage 4 endometriosis, these patients benefit from the surgery. So the decision in terms of patients whether they need surgery or not for endometriosis is very much individualized. So we cannot say the blanket rule for everyone and get thousands of patients to do operation unnecessarily, because operation itself is not free of risk, especially if stage 3, stage 4 endometriosis, it can involve even bowel surgery. It can make things much worse. So a lot of time we achieve successful pregnancy using IVF, and some patients we do medical treatment of endometriosis, which is down regulation of ovaries for 3 months, 4 months. That will relieve the inflammation. It opens implantation window. Once you achieve successful pregnancy, then progesterone produced from the placenta will keep endometriosis suppressed. If this severe endometriosis causes problem in the future after they complete their family, once they have the kids, then they can have a surgery for endometriosis. So simply doing surgery for everyone is not right thing in IVF. So we are very selective and very individualized. We do provide individualized advice in patients who have endometriosis. Like I said, 25 to 50% of women undergoing IVF have endometriosis. Most patients get successful pregnancy without actually surgical treatment of endometriosis. But actual most effective treatment is excision, which is removal of endometriosis by doing surgery.